Senate Republicans are making big changes to President Trump's Big Beautiful Bill. The sweeping measure to cut taxes and reduce spending expected to hit the Senate floor next week. The House version required able-bodied Medicaid recipients with no kids to work, volunteer, or go to school for 80 hours a month. The Senate version extends that to those who have kids over the age of 14. It also limits an accounting maneuver states use to increase payments to Medicaid providers. Among the provisions that remains unchanged, an elimination of a tax credit that has helped lower health care premiums for thousands of Coloradans. Your political reporter Sean Boyd has been tracking this bill. And Sean, the tax credit set to expire the end of the year.
Yeah, and Coloradans on the state exchange could see their health care premiums increase by $3,000 a year. 80% of people who get their insurance on the exchange receive a federal tax credit. While some of the credits are tied to income, the American Rescue Plan expanded credits to everyone. And in rural and mountain communities where insurance can run a family upwards of $30,000 a year, those credits have made insurance affordable for tens of thousands of Coloradans.
In a way, we're both entrepreneurs.
You'd be hard-pressed to find a couple more civic-minded than Ryan and Robin Wilson. Both work for nonprofits in the town of Fraser. He runs a community radio station. She manages an affordable housing community. Together, they make just enough to make ends meet, which made them eligible for tax credits under the Affordable Care Act. Until this year. To qualify, they can't make more than 400% of the federal poverty level, which is $85,000 for a couple.
We're at 402%, so we're just 2% over.
Robin considered quitting a community college teaching job to lower their income until she heard about a new advanced premium tax credit created during COVID. It caps premiums regardless of income at 8.5% of a household's earnings, making insurance affordable in many rural and mountain communities, and leading to record enrollment on the state health exchange, where the average premium is now $115 a month. But in December, the expanded tax credit expires, and Connect for Health says premiums will more than double. CEO Kevin Patterson expects 50,000 Coloradans to drop coverage due to expense.
Across the board, we're expecting to see monthly premiums increase by about 50%. For the folks that have financial assistance, which is about 80% of our 280,000 customers, we anticipate those premiums could increase by about 104%.
We've been able to dedicate our lives to our local community more so than if these tax credits weren't there.
The Wilsons say instead of expanding their nonprofits, they will now likely have to shrink their income to qualify for the original credit.
It shouldn't be a sacrifice, a financial sacrifice, to do good work in a good place.
And a vote against these premium subsidies is a vote against the middle class. It's a vote against the poor.
Connect for Health says Coloradans receive about $328 million a year in tax credits. The state reinsurance program, which has lowered premiums by $2 billion over the last 5 years in Colorado, would also take a hit if the tax credits expire. The credits are based on the cost of premiums, so when premiums drop, the federal government pays less in tax credits. The feds have passed those savings on to states, and Colorado has used the money to bolster the reinsurance program and lower premiums further. But those savings, $100 million a year in Colorado, would be lost with the elimination of the tax credits, which is why Governor Polis is lobbying Colorado's congressional delegation to keep the credits rather than allowing them to expire in December. Sean Boyd covering Colorado First.